The partnership between the town of Kittleville Hills and the Community Care Clinic is really about reaching out to people who need the service. So for us, it's about trying to help with promotion and sharing what the mission is and how people can get help. And certainly from the Community Care Clinic side, it's filling the needs for medical care for people who really have medical issues and who need chronic disease management and acute care.
The Community Care Clinic at Dare has been here since 2005. It was founded through a partnership with the Dare County Department of Public Health, the Albemarle Hospital Foundation, and Outer Banks Hospital. In 2002, a county health assessment showed that 24% of our population had no health insurance. This, of course, had a significant effect on the overall health of the county, and something needed to be done. So steps began, and through the partnership that I mentioned, the Community Care Clinic at Dare was founded. We opened our doors in 2005. Our purpose is to provide basic health care, medication assistance, and wellness education for the uninsured and financially challenged people living or working in Dare County. Since inception, we've seen over 3,000 distinct patients. Right now we have about 550 patients. We are our own 501c3. We're completely dependent on outside giving. Ours is a free clinic. We charge nothing for our services for our patients. As a result of that, we do have limited resources and we cannot just open our doors to anyone. So we do qualify our patients. We are fairly liberal in our income qualifiers. We will see patients who make up to 250% of the federal poverty level.
Primarily what we take care of here are diabetes, hypertension, hyperlipidemia, which is high cholesterol, COPD, and thyroid issues. So for the general population that needs a primary care home, we can provide that for chronic conditions. Acute conditions, small stitches, lacerations, we can take care of that. Anything beyond that, we'd send them to the emergency room. What we're trying to offer here for people in the community is a primary care home to take care of those chronic conditions. It gives them continuity of care by seeing the same people here, and we think we have a great facility. It looks like any regular doctor's office. We collaborate with some specialists that come in and offer free clinics, orthopedics. We have primary care doctor that comes in for our Spanish-speaking patients. As far as coming into the lab here, we have a wonderful facility here to triage our patients. We can do all of our own lab work here. We are able to do patient education via a litany of information and literature that we have here. And we recently got iPads via a grant. So the iPads will be helping us with our electronic health record and also education for our patients. We like to think that we are a great place for people to come, manage their condition, get medication assistance, which is another thing that we offer here. Last year, via grants, we wrote close to $2 million in free medication for our patients. So we kind of provide everything for primary care.
We're dependent on fundraising. We're dependent on individual giving. We're dependent on corporate and civic giving and grants. The town of Kittleville Hills has always been one of our big supporters. The larger part of our population base are Kittleville Hill residents, and we're very proud to be serving them. And we're also proud of the relationship we have with the town of Kittleville Hills. They've been very supportive over many years.
This tour was really great for all of us. It was an opportunity for the commissioners to see really what's here and what the Community Care Clinic has to offer for the community. It's also going to be a great way in sharing this video for the public to see. I think there's people out there that have probably heard about the Community Care Clinic, but maybe nervous because they don't know exactly what it is. And so to be able to see this facility and see how it's like going to any doctor, you know, that it's quality care by quality people who really care about what they're doing in a beautiful facility with state-of-the-art equipment. I think that hopefully will go a long way to helping get others who really need this type of care to get them here to get it.
I'm always very proud of what we've got here. It's a very nice infrastructure, and I'm very pleased to show it off.